Breast Cancer Media Literacy. Thank you so much for joining us today. My name is Saru Kaiser, and I'm the Education and Mobilization Coordinator at Breast Cancer Action. On the webinar today, our presenters will be Gary Schweitzer, publisher of Health News Review, and Mandy Starr, reviewer for Health News Review. A few quick announcements before we get started. As many of you on the call may know, Breast Cancer Action doesn't take money from any corporation that profits from or contributes to the breast cancer epidemic. Our work is largely supported by individual donors. Please consider making a $25 donation today to support work like these educational webinars. Our presentation of Separating Hype from Hope Breast Cancer Media Literacy will last about 40 minutes. We'll make sure to save time at the end for questions. During the webinar at any time, you can type questions into the question bar over on the right-hand side. At the end, we'll gather all the questions and answer as many as we can. Everyone except the speakers will be muted during the webinar to cut down on any background noise and to ensure that we can all hear well. Also, a recording of the webinar will be available on our website by next week, and we'll also be sending out a PDF of the slides to everyone who attended. We want you to get involved with Breast Cancer Action. This webinar is a great way to do that. Please stay tuned for other ways we'll mention later on. So I'm going to start by going over our agenda today. So Gary will start by talking about the 10 criteria Health News Review uses to evaluate and review coverage of health news. He'll also talk about how and why health coverage in the media gets it right and where they also get it wrong. And last, he'll discuss the current state of health journalism and its impact on the consumer. And then Mandy will talk about how a health issue becomes newsworthy and how you as a consumer can be part of the evaluation process by giving journalists feedback and asking key questions. Last, I'll wrap up the webinar describing Breast Cancer Action's critical analysis of breast cancer and how you can get involved in Breast Cancer Action's work. So Breast Cancer Action was founded in 1990 by a group of women who were frustrated with the lack of information about breast cancer. Our founders, only one of whom is still alive today, knew that their private medical crises were part of a larger public health emergency, and that the experiences of those dealing with breast cancer needed to be heard to address the crises. Breast Cancer Action's mission is to carry the voices of people affected by breast cancer to inspire and compel the changes necessary to end the epidemic. Our advocacy is conducted through a social justice lens because the politics and policies of breast cancer disproportionately affect poor women and women of color. Breast Cancer Action's independence from pharmaceutical company funding puts us in a unique position to address issues of health equity and exposures to toxins in our environment, and to put the needs of patients before pharmaceutical company profits. We have three main program priorities: putting patients first, where we advocate at the Food and Drug Administration in favor of treatments that are less toxic, more effective, and less expensive than those already available. We also provide information about breast cancer to anyone who needs it. The second is creating healthy environments, where we work to reduce the involuntary exposures people encounter that put them at risk for breast cancer by holding corporations accountable for unhealthy products and practices. We also support legislation that would better protect us from chemicals in our environment and that would make personal care products safer. And the last is eliminating social inequities related to breast cancer, where we work to create awareness that it is not just genes, but social injustices, political, economic, and racial inequalities that lead to disparities in breast cancer incidence and outcomes. Our first presenter today is Gary Schweitzer. He has specialized in healthcare journalism for nearly 40 years. He is publisher of the healthnewsreview.org, an award-winning site that grades health news. For 9 years, he taught health journalism and media ethics at the University of Minnesota. Gary worked in television news for 15 years in Milwaukee, Dallas, and CNN. He was founding editor-in-chief of MayoClinic.com. The Kaiser Family Foundation published his 2009 report, The State of U.S. Health Journalism. He wrote the Association of Healthcare Journalists Guide for Reporting on Studies and the group's Statement of Principles, and in 2009, one competition named his blog Best Medical Blog. Welcome, Gary.
Thank you. We're really happy to have this opportunity to talk about our work.
We also have Mandy Starr. She's a current reviewer for healthnewsreview.org and earned her PhD in epidemiology at the University of Minnesota. She is both a young breast cancer survivor and advocate participating in the National Breast Cancer Coalition's Project LEAD and serving as a consumer reviewer for the Department of Defense Breast Cancer Research Program. In addition to her advocacy work, Mandy has worked with the Center of Disease Control and Prevention, where she is a current epidemic intelligence service officer, the National Institute on Alcohol Abuse and Alcoholism at the National Institutes of Health and the Veterans Administration. Her previous work has focused on describing the prevalence and consequences of binge drinking and smoking cessation. She asked that we post this disclaimer. The views expressed in this webinar do not necessarily represent the views of the CDC or the United States government. Now I'm going to turn it over to Gary to give his presentation.
Okay, thank you. And thank you all for your interest in joining us on this webinar. So we're going to be sharing with you the findings in a nutshell of our work every day for more than the past 7 years in evaluating healthcare news, and then in grading these efforts and in posting the grades online and in notifying journalists that their work has been reviewed. But it's far more than just a journalism project. Increasingly, we have taken on a direct-to-consumer approach, figuring that if journalists are defensive or thin-skinned, none of us takes criticism perhaps as well as we should, then at least consumers could learn how to improve their critical thinking if they look at how we review stories and how we apply analysis and critical thinking skills to the review of stories. So, I do have control, don't I? Okay, here we go. So this is a screenshot of our homepage, and what you see here at the bottom is that for every day for 7 years, in our combined approach on this site, which I'll talk about in a moment, we have looked at more than 3,500 media messages, including not only news stories, but healthcare ads, public relations messages, marketing messages. As I said, there's two elements to our work with sort of an overlapping common theme. So the news stories are the more objective, systematic, pure process, criteria-driven part of our work. To be eligible for review, it has to be a story that includes a claim about new stuff in healthcare, new interventions, treatments, tests, products, procedures, dietary approaches. And it has to be done by one of the news organizations that we review regularly. We can't look at everything, so we have a set number of media that we look at every day. And then the second part of our work is on a blog, which in the nature of most blogs is more opinionated, more subjective. And on the blog, we commonly look more at advertising, marketing, public relations, journal messages and journal influence on the public dialogue, and things that affect us in this messy intersection of medicine and public health and media. And it also allows us then to look at the broader influence of industry, drug companies, device manufacturers, hospitals on the public dialogue. Today on our blog, for example, we blogged about how even Johns Hopkins, one of the leading medical centers in the country, apparently finds it necessary to make marketing claims about their use of robotic surgery for hysterectomy, about which there have been some evidence questions raised. So that's what we look at in the blog. These are the 10 criteria that we apply to the review of news stories when we do that. I'm only going to touch on this because Mandy's going to look at each of these in more detail. Mandy, as a reviewer, will walk you through some of the questions behind each of these questions, but this is what we rate the stories on. And it's interesting, you know, I want to hit on Breast Cancer Action's theme of putting patients first, because we look at these 10 questions as questions that journalists need to address if they're going to put patients first. In fact, on our homepage, we refer to these 10 questions as things that we think consumers need answered or addressed whenever claims are raised about healthcare intervention. So when journalism does a great job, and many times it does, it's when it's clear that the reporter and editors put patients first. And when they don't do a good job, something else is being put first, not patient interests or patient needs or questions like these. So you'll hear more about these questions from Mandy in a moment. I'll cut to the chase. Here's the report card on the worst of the offenders after looking at more than 1,900 stories over more than 7 years. This is never just my opinion, and in fact, it really isn't opinion-based. As I told you, this is a systematic set of criteria that we apply every day. And we always have at least 2 reviewers. We try to have 3 reviewers, and so Mandy is one of them. And here's what we found, that between 60 to 70% of the stories fail on what are arguably the 4 most important of the 10 criteria. So remember, we're talking about new stuff, and up to 70% of them fail to discuss the cost of that stuff. Pretty important item for most healthcare consumers, especially when we Americans spend a greater percentage of the GDP on healthcare than any other country on the face of the earth. More than 60% fail to explain how big is the potential benefit and how big are the potential harms, but this is often a matter of failing to explain how small are the potential benefits and how large are the potential harms. And then more than 60% fail to evaluate the quality of the evidence. So this is like throwing everything into the same kettle, where we treat mouse studies or phase 1 drug studies as if they're the same and hold the same weight as 3-year, 3,000-person randomized clinical trials. So I think we can do a better job. Those data points suggest to us that 70% of the time, news stories are painting a kid-in-the-candy store view of U.S. healthcare, where 70% of the time they make things look terrific, risk-free, and without a price tag. And I worry about not only what is the impact on the public dialogue, water cooler talk, blog talk, but what's the impact on the patient-physician relationship with the issues at hand in these news stories? What's the impact on individual decision-making? We know, rightly or wrongly, that a lot of people get much of their healthcare information from the media. And what's the impact on the voter? What's the impact on that guy or the woman going into the voting booth next to me? I think about this on election day. People who might oppose any candidate who supports comparative effectiveness research or evidence-based medicine, because with so much story framing, they've been led to believe that that's rationing, not rational. Again, I think we can do a better job. These are health policy stories that we're looking at. They're just not framed that way. I think that we've got an American public that is thirsty for just a little sip of unbiased, balanced, meaningful healthcare information to help them navigate this confusing non-system that we have in this country, in this maze of treatment options, and yet they want just a little sip, and we drown them. We overpower them every day with a tsunami or a fire hose of information. There's a European journalist, I believe, who coined this phrase, intoxication, which is information intoxication. Not all that we get every day is indeed newsworthy or ready for prime time. So here are some of the common flaws that we've seen when we look at stories and messages every day. There's just far too much stenography, anything that appears in a medical journal seems ripe for publication. And you know, we expect journalists to do some independent vetting. It's not as if everything in a journal was cast in stone tablets and ready to be brought down from the mountaintop from Moses to give to the people. We tend to glorify big names and big journals. Just because it's in the New England Journal of Medicine doesn't mean that the findings are true or that they're even important. Doesn't mean they're ready for prime time. Let's remember, journals are meant to be primarily a conversation among scientists. They were never meant to be what they have become, and that's a source of daily news. Now, it's fine if you want to make them a source of daily news if you know the landscape. But if you don't, you shouldn't be playing this game. And so part of the landscape is knowing how to evaluate what is just really inherently immature and weak science. You need to understand things, and this comes into play in cancer issues and breast cancer issues a lot. Idolatry of the surrogate, some have called it, and that is reporting on surrogate outcomes, things like tumor shrinkage, which may not translate into anything that's really meaningful in a person's life, like did she live longer or did she live better? So we shouldn't just focus on the surrogate outcome, but focus on outcomes that really matter in people's lives. We see a lot of reckless extrapolation from preliminary animal research or laboratory science into what may happen in humans, and the implication is often that it may happen soon. If we track the batting average on many of these, it would be very poor. And if you're going to report on stuff in journals all the time, you simply have to be aware of the conflicts of interest that are around every corner in healthcare and other ethical issues that affect the integrity of what's being reported. In business stories, in local business stories, and on stories out of your local medical center, your local academic medical center, we just see many journalists going soft and reporting on things that they would never report on if it even came from somebody across state lines, or if it came from a business not in your locale. Why? Do we have an entirely different code of ethics for local stories? I don't think we should in healthcare. So the boxing analogy to me holds up in this comparison, because those who use the media to get their conflicted, biased messages across to the public are now often overwhelming a weakened competitor like this boxer who has his opponent on the ropes. Many newsrooms are reeling from staff cutbacks. In many newsrooms, many reporters are being asked to do more with less every day. They have to meet really ridiculous story quotas. They have to ensure internet click rate to make sure that people, if you've ever wondered why there are so many surveys or polls within a news story, it's because every time you click on one of those, you're driving up the click rate, and that's what editorial offices tell advertisers to make it look like more people are clicking on their stories. It's just part of the game that goes on. Meantime, there are slashed budgets for travel and for on-the-job training, and so many of the punches and counter-punches from those who are trying to manipulate the media slip through because there is a defenseless opponent. But it doesn't end with that media adversary. They slip through, the messages slip through to the public, and that's why we really should care. So if this were just a one-slide talk, this would be it. Our data show that over and over again, media messages exaggerate or emphasize benefits and ignore or minimize potential harms. But as you'll see in a moment, it's not just with media messages. This is the way we talk about healthcare in general in this country. And there's harm in this picture. The one topic that drives me, and I think many of us on this project, up the wall more than any other, is how journalists and how media messages cover screening issues. It's like screening media madness. not just on breast cancer, although those are right up there, but prostate cancer, lung cancer, heart and artery screening issues, osteoporosis, osteopenia issues, genetic screening. I could go on and on and on. We crossed the line from independent vetting that we expect from journalism into what we often see as more crusading, one-sided, non-evidence-based promotions. I want to make clear that in saying this, I am not anti-screening. I do oppose imbalanced, incomplete messages about screening. I oppose messages that emphasize benefits and minimize or ignore harms. Sir Muir Gray of the UK coined the phrase that ought to appear in all stories about screening, that he said, all screening tests cause harm. Some may do good as well. And finally, I oppose messages that only tell anecdotes of those who claim their life was saved by screening, something that can never be proven. If we're going to tell those stories, we need to try to balance it with the stories of people who have real life stories of harm caused by screening outside the boundaries of evidence. So I told you it's not, remember that scales of justice slide about the emphasis on evidence on benefits and the ignoring of harms. Well, if stories are based on studies, here was a study about studies that showed how imbalanced were some even randomized clinical trial reports on breast cancer. So there was an emphasis on efficacy or usefulness and an ignoring of harms. Investigators going overboard to make their studies look better than they may have been. In 2/3 of the studies, that meant not listing serious side effects in the abstract. And let's face it, if for many people, physicians, scientists, journalists, lay people, if you do read studies, many of us never get beyond the abstract. I think we need to find a way to get beyond the abstract for reasons like this. And in 1/3 of the studies that were looked at, if the treatment and the research protocol didn't work as originally designed, well, researchers simply reported on something else, that the study wasn't designed to test, so-called secondary endpoints. But how would the lay public know this? So stories about studies may be inherently flawed because the studies themselves, as we say here, went overboard to exaggerate findings. And in another study, now, how do people in studies react to benefits and harms? Well, this is the study of institutional review boards, which are the bodies that review the ethics of informed consent and study design. They found unrealistic optimism in many early-stage cancer trials, and they found that people in the trials tended to overestimate the benefits of the trial they were enrolled in and underestimate the risks. Well, is there any reason how this could be happening when we've just seen that scientists themselves do this and news stories do this? This is the frame in which we look at research in this country all too often. So my summary slide is that all of us who communicate about healthcare need to find a way to help people deal with the clash between science and intuition, between evidence and just emotion, between data and simply anecdote. The plural of anecdote is not data. To help them understand the difference between recommendations for the entire population and decision-making by an individual, the difference between what we can prove and what we simply believe, wish, or hope would be true, and the difference between grasping uncertainty and helping people apply critical thinking to decision-making issues, the difference between that and promoting false certainty where it does not exist. So as you heard, I worked in TV news for 15 years, and some friends have said that if I stayed in that line of work, this is what I would have looked like today. My wife says, well, what do you mean, Gary? This is what you look like anyway. But I used this picture because this was the anchorman from the old movie Network who would urge his viewers to go over to the window, raise it, stick their head out the window, and holler, "I'm mad as hell and I'm not going to take it anymore." Well, in a more gentle, subtle way, this project is sort of my attempt to raise the window and stick my head out the window and say, I'm pretty upset with the way media messages are conveyed, and I don't think we should take it anymore. And this was our attempt to have some constructive outreach to improve the public dialogue. So after we hear from Mandy, I look forward to your questions, but I'm now going to turn the microphone over to my terrific colleague, Mandy Starr, who will give you a reviewer's and a patient's insider's perspective on some of these same issues. So take it away, Mandy.
Thank you, Gary. Okay. I have control now. Okay. So what I hope to achieve in my presentation is a further discussion about how the media portrays messages about breast cancer, and also to share some of the specific tools that I've used when I review articles for healthnewsreview.org. So these are just some of the headlines I actually found online when I was just doing a straight Google about breast cancer risk. So we're bombarded every day with countless news stories about what may increase or may decrease our risk of getting breast cancer. And unfortunately, what this constant stream of conflicting messages tends to do, well, one, it confuses everyone. And then after a while, most of us just start ignoring these stories and ignore the health findings. So a brief background told you a little bit about myself. I am an epidemiologist by training. In epidemiology, we study public health, so the health of populations, not just the health of an individual. I have both a master's and a doctorate degree in this. I have experiencing with publishing and with actually creating news stories from research findings in my area of binge drinking and smoking cessation. Also, I was diagnosed with breast cancer in 2010. I'm what is labeled as a young survivor. I was diagnosed under the age of 40. And so I approach reviewing stories both from that as somebody who has had a survivor of breast cancer, but also as a researcher too. So if epidemiology has taught me anything, it's to be skeptical, and pretty much to be skeptical of everything, to ask lots of questions. And so many of the news stories suggest in their titles things like a new discovery or a breakthrough, or my favorite is cure. I mean, this is one I have the most problems with. My skepticism usually begins with the question, are the findings really that groundbreaking? So one question I ask a lot is, how do findings become news stories? The answer is there's many ways. A lot of times results are presented at conferences, and many journalists do cover big conferences, and they will write on stories about some of the research that's been presented there. A lot of us publish journal articles, and the journals themselves will actually send out press announcements about upcoming articles that they think the media might be interested in covering. There's also communications offices play a huge role. These are communications offices not only in academic settings, but also in government settings and also private industry. So the communications office's role is also to get the word out about research findings. And so they may know reporters who might be interested in some of the stories, or they may send out brief write-ups to news agencies. A lot of these brief write-ups are sent on newswire services, so to the Associated Press or to Reuters, and a lot of times you'll see reprints of either AP or Reuters articles in a lot of local papers. But the bottom line is that research findings, in order to become news, someone had to put forth the effort to get the word out to the media. And so are all findings that are printed in the media, are these really newsworthy? Well, we have this area that I like to call hot topics. So what's hot? What's trending right now? One of the big stories is that Angelina Jolie, she had the prophylactic double mastectomy because she was BRCA1 positive. And I'm going to have to switch my headset real quick. Okay. Had the same problem yesterday. My headset cut out. So I did a quick Google search of Angelina Jolie and breast cancer and found 109 million results. So this is obviously a hot topic, and it's one in which we're probably going to see a lot of news stories related to BRCA1 and specifically to mastectomy. Also, you have a lot of stories that get traction because they go along with common or accepted beliefs, specifically beliefs about breast cancer. But even more so is when we have research studies that come out that are released that tend to go against common or accepted beliefs, there tends to be a big backlash. The specific example I wanted to use is a few years ago, the Preventative Services Task Force came out with recommendations against mammography for women under age 50. Now, this was a general population recommendation. There really were very few stories talking about how the task force came to that conclusion, and instead most of the stories tended to be focused on how those recommendations were bad. And there's also a publication bias, and Gary talked a little bit about this, and this is extremely important. There's a lot of journals that won't publish null findings, and it's not that they have anything against it, it's just they know that people will be more interested when you find a significant result than if you were to say there is no association between X and Y. We tend to struggle as researchers, too, on whether or not it's even worth our time to submit papers that found no results to journals, knowing that they probably won't be accepted for publication. And so I feel that we have this oversaturation of breast cancer in the media. Results are overestimated, particularly we see this overestimating of risk. And we see a lot of stories that take those cases that are rare or that only affect women who are high risk and sort of talk about the story in a way that makes it seem more common. And so what we've seen, and there's been studies that have shown this, is that a lot of women overestimate their risk of getting breast cancer. I also feel that there's a lot of misplaced focus in the media. We focus a lot on emphasis and the benefits of screening and not talking about, well, if we have all these screenings and we have all these treatments, why are still we seeing this high incidence of breast cancer? What is not changing over these years, or what is causing all these breast cancer cases to still be detected even with all these good tools that we have? You know, one of the problems is we get fatigue and we get resentment. I hear a lot of people are saying, oh, here's another breast cancer story. You know, why don't we focus on other diseases? And this has been brought up very often about the #1 killer of women is actually heart disease, not breast cancer, but there's all this focus on breast cancer. And one of the topics I'll touch on briefly and Saru will talk about is awareness and how we talk all about breast cancer awareness. We have a Breast Cancer Awareness Month, and we have these pink ribbon campaigns. And I've sort of come to the conclusion that if you have breasts, you're aware you can get cancer. But we need to move beyond this awareness. And I think one of the problems is that breast cancer awareness has in and of itself become its own industry. And so you tend to see a lot of articles coming out in October, sort of talking a lot about breast cancer awareness and how it affects women. I want to also talk briefly about internet memes, if people are aware of this or not. This is another area underneath awareness. We see this sometimes on Facebook where women will post like the color of their bra, and they said, oh, it's supposed to make more women aware of breast cancer. Frankly, it just tells you how colorful some people's underwear is. It really doesn't have anything to do to fight breast cancer. But then the media sort of helps these stories along by focusing in on them and talking more and more about breast cancer awareness and pink ribbons and memes. And it really doesn't do anything, I feel, to help find out what's causing breast cancer and better treatments of it. I want to talk a little bit about how I got involved with healthnewsreview.org. After I was diagnosed and being a researcher by training, I wanted to do more than focus on awareness of breast cancer. I wanted to do more than just fundraise or just run a race. I really wanted something else, something that I felt was contributing to more the dialogue about breast cancer. I wanted to also regain control of what was happening to me. And I heard Gary talk about healthnewsreview.org at a training that I was at to become a breast cancer advocate, and I thought that would be a perfect place for me to put some of these skills that I learned in public health to good use. And so what I'm going to do is talk to you about some of those skills that I have and also partake to you, give you some of the skills that I have, so hopefully you can do some of the same work that I do. Let's see. So what can you do? Be a squeaky wheel. Bring articles to the attention of healthnewsreview.org. If you have blogs, a lot of people have blogs, write about them in blog posts. Ask questions. Email the reporter of those stories if you feel that some of the questions you have weren't answered by the story. A lot of times the email address of the reporter is either, you can find it if you Google it, sometimes it's written next to the article itself. You can write letters to the editor. You can also you can write letters to the editor not only to support certain stories, but also if you feel a piece didn't adequately discuss a topic. You can ask Breast Cancer Action to do some of this work for you. You can ask them to meet with editorial boards of some of these publications and to really focus on putting the patient first. And some of the criteria that I use, the 10 criteria that Gary talked about for healthnewsreview.org, these have questions that go with them. And what I'm going to do now is go through the 10 criteria and some of the questions that we use. And so the next time you see a story, you can actually see if whether or not the story has met these 10 criteria. So the first one we talk about are costs. How are costs mentioned in the story? A lot of times they're not even mentioned. Is there a discussion of cost comparisons between new approaches and the current approaches? Are the costs downplayed in the study without any sort of explanation about why? So how are benefits framed in a study? Excuse me, are the benefits explained only through patient anecdotes or investigator comments without supporting data from a clinical trial or study? Are they relative, not absolute benefits mentioned? And so let me give you an example of this. You'll hear phrases like, well, we saw a 50% reduction. Well, the first question you should always say is, well, 50% from what? And 50% sounds a lot better than saying, well, we saw a reduction in risk from 2% to 1%. Okay, click the wrong thing. Oh, there we go. And then how are harms framed in the story? One of my biggest pet peeves is when harms aren't even mentioned or quantified in a story, especially when they're talking about a new procedure or a new technique. Are the severity of the harms or side effects mentioned, or even minor side effects discussed, because these can have a significant impact on quality of life? Does the story rely too heavily on patient anecdotes, again, or investigator comments without supporting data, very similar to how the benefits are framed? There you go. Does the story grasp the quality of the evidence? So you should always see limitations to clinical trials or to any sort of results, especially if there's been small sample sizes. So drawing conclusions based on 10 people will vary differently if the population was around 10,000 people. Were the results only seen in animal studies? So Gary also mentioned this. We see a lot of animal studies and trying to extrapolate to humans. We see this a lot with mice studies because there are certain mice out there that are bred specifically with a breast cancer gene, so scientists can run experiments on them, but can you really extrapolate what a mice has a tumor goes through to what a human will go through? The other thing you have to be careful of are when they talk about lab settings or petri dishes and the results that we're seeing in that. That doesn't mean it's going to translate directly into human studies. Were the studies of the outcome the same as the health outcome portrayed? Gary talked about these secondary outcomes. So was the study really looking at longer life or survival, or was it focused more on how a tumor would behave under certain situations? So I specifically give an example of, was the treatment, did it slow down cell division or did it completely destroy the tumor? And is there evidence of disease mongering? And I like this term a lot because we see this in a lot of news stories. Pay attention to how some risk factors are framed as if they are already disease. You see medicalizing of normal states, baldness or wrinkles, and you're treating rare, unusual cases as more commonplace. And I think that's one of the problems we have with breast cancer is when you see some of the individuals who have like a BRCA1 mutation or a BRCA2 mutation, and you see stories that the population was this, which is a small proportion of the women who get breast cancer every year, but then trying to treat these stories as they're much more commonplace, that everybody has a BRCA1 mutation, that everyone has a BRCA2 mutation, and therefore we're all at increased risk of getting breast cancer, but that's actually not the case. There we go. And is an independent source quoted or conflict of interest disclosed in the story? What's the source of the news story? A lot of times they'll mention in the story if it was at a conference proceedings or if it was published in a particular journal. But are the conflicts of interest in the people quoted in the story disclosed? Did they receive funding from a company that's producing the treatment or the drug? Was an independent source, someone who had nothing to do with the study, quoted in the story? These are very important because you need to have someone who's not involved. It's what we call as peer-reviewed to talk about the study and to talk about the results of it. Okay. And then are alternatives to the treatment or to the option or to the procedure, are they mentioned? How does the new whatever it is that's covered in the story compare with existing approaches? How does it fit in with the realm of existing approaches? And this is where I also go back to there needs to be a discussion of harms too, because sometimes you'll hear about a new treatment that maybe it can be used in conjunction with like chemo, but this new treatment will also kill your kidneys in the process. This needs to be mentioned. What is the availability of the new treatment or item or approach? Is it currently available? Is it only in clinical trials? Has it received FDA approval? Is there a time frame for approval? Is there a time frame that's given by somebody outside of a company spokesman? How widespread is the new approach? Are there plenty of medical personnel who are already trained to deliver this new approach if it is something that's like a new type of surgery versus just a screening mechanism? And does the story talk about the novelty of the new approach? Is it really novel? Why is it new compared to the alternatives? Is the treatment really just off-label use of an approved drug? Does the story go into details? Does it talk about this? Does it actually say, well, this is a drug that's already on the market, but it's currently used for X, Y, Z? And then the final criteria and the questions that we use is the story based solely or largely on a news release? Are there independent sources mentioned in the story or cited? If they are, more than likely it is not based solely on the news release. Sometimes you can tell if you search Google or another search engine, you put the researcher's name in at the topic, you might see the actual press release that came up about that. Is the story also just a reprint of an AP or a Reuters story? Usually it's denoted in the title, it'll have like the name of it, and then right next to it it'll have like AP or Reuters. So then I'd like to end my section with sort of imparting on you to question everything. So go back to when we were children, when no answer satisfied us, and just constantly ask questions and constantly ask why. Let's not be satisfied with the answers that we're given. Let's not be satisfied with the news stories in front of us. Let's all be squeaky wheels. Let's all ask and expect a higher level in journalism. So thank you.
Thank you so much, Mandy, and thank you so much, Gary. I want to take a minute to talk about Breast Cancer Action and the work that we do to analyze the news, both the current news and also sort of trends and assumptions around breast cancer. So Breast Cancer Action delivers unbiased information and education, and we do that to empower and support all women living with breast cancer, as well as caregivers and those at risk for the disease. And we do that so women can make health decisions that best meet their needs. We also take our role as a trusted watchdog organization that fearlessly tells the truth about breast cancer very, very seriously. And we do that because we have a really strict and very wonderful corporate contributions policy. And this policy enables us to take action and tell the truth with integrity and credibility. As I said before when we began the webinar, we don't take a dime of corporate funding from organizations that profit from or contribute to the breast cancer epidemic. So that allows us to be a real independent voice. And we're nationally known and recognized for putting patients before profits, as Gary spoke about, regulating cancer-causing toxins, and eliminating health inequities. And on a daily basis, we provide regular analysis of the current news, and we bring a feminist social justice analysis to the national conversation on breast cancer in the fields of environment, health, and inequities. We use social media, we use e-alerts, and also our blog to cover topics such as treatment issues, mammography, compassionate access to care, and also other topics that directly affect patients. Two examples that I pulled from our blog and our e-alerts. One is around Angelina Jolie that Mandy spoke about, which was titled Celebrity Breast and Corporate Gene Patents. And we wrote about how one celebrity's personal medical decision is really a much bigger story. We also addressed how one company's patents, Myriad Genetics, on the human BRCA1 and BRCA2 genes really have a number of harms to women. Another article titled Making Room in the Breast Cancer Narrative, Social Injustices and Health Outcomes challenged the concept that race and class inequities in breast cancer outcomes are really solely the fault of low screening rates, limited access to health care, or individual lifestyle choices. We explored how the reality is really that inequities in breast cancer incidence, mortality, and survival stem from a complex interplay of social and economic factors, and those include power dynamics, race, ethnicity, and also discrimination. We also have some long-standing policies and positions, and those policies and positions work to challenge assumptions in the breast cancer field and also inspire change. And we do that by framing breast cancer issues in really unique ways that are far different from the mainstream views. And the purpose of our policies on issues ranging from breast cancer screening to corporate contributions to gene patenting is to really ground and guide our policy work and clearly present our perspective on breast cancer issues. In doing that, we seek to fundamentally change how those issues are both understood by the public and also how they're approached and resolved by the cancer industry, by government agencies, by the media, and the larger healthcare system. I wanted to just give an example of how we have challenged long-standing concepts in breast cancer through the media. And one of those campaigns is our Think Before You Pink campaign, which we've been doing for about 11 years. And out of that campaign, we've also developed a term called pink washer, which for those who are not familiar is when a company or organization that claims to care about breast cancer by promoting a pink ribbon product at the same time produces, manufactures, or sells products that are linked to the disease. And through that Think Before You Pink campaign, we have people not only in October but throughout the year really asking pointed questions about what we have to show for 30 years and billions of dollars spent on breast cancer. And our analysis really extends beyond current media, but gets to sort of some of these long-standing beliefs that media continues to report about by challenging assumptions through our educational materials. And that includes our fact sheets, which are really provide concise, science-based information on various issues of interest to people concerned about breast cancer. And we provide a critical analysis of these important breast cancer advocacy topics, again, by challenging long-standing assumptions about the disease and also inspiring people to make change to address and end the breast cancer epidemic. Each fact sheet provides a general overview of the topic and a framing of the issue, a clear and consistent foundation of information, and also Breast Cancer Action's perspective on each topic. We also have webinars like this webinar, and with our partners such as Gary and Mandy, our webinars really offer crisp analysis and information on numerous topics that you won't always see anywhere else, and that includes the politics of breast cancer, toxic cosmetics, gene patenting, breast cancer screening, inequities in breast cancer, and more. And last is our newsletter, our quarterly newsletter called The Source, and it's an educational resource written by a variety of people working in the field. It includes writers from our staff, from our membership, scientists, subject matter, and also subject matter experts working in the field. And we cover issues such as breast cancer treatment updates, news on links between breast cancer and environmental toxins, analysis of inequities in breast cancer. We profile some of our members, and we have calls to advocacy. It's also one of our primary vehicles for keeping our members informed and moving them to action. So I wanted to highlight a few resources that we have talked about through the webinar. The first one is Health News Review website. And as Gary described, healthnewsreview.org works to help consumers critically analyze claims about healthcare interventions and promotes the principles of shared decision-making, reinforced by accurate, balanced, and complete information about the trade-offs involved in healthcare decisions. There's also PubMed. So sometimes if you have questions about a health story, that's based on a journal article, you may be able to go to the actual original source. And this link will take you to PubMed, where you can type in the title of the article and pull it up. And some are restricted, unfortunately, and some are open access, and those are ones that you would be able to access as the general public. Health News Review also has a really wonderful toolkit, and in it is a number of tip sheets, primers, links, and other resources to help both journalists and consumers do a better job of evaluating claims about healthcare interventions. And as I was talking about before, I think before ePink campaign, we have a toolkit, and in this toolkit you'll get resources and information and tools that you need to take action to hold pinkwashing corporations accountable. You can deepen your understanding of the politics of breast cancer. It'll help you ask questions to be certain that your valuable dollars are going to addressing and ending the breast cancer epidemic. And also, it will help others learn the truth about breast cancer and pink ribbon cause marketing. So we're going to open it up to your questions in just a minute, but before we do, I wanted to talk a little bit about how you can get involved with Breast Cancer Action. You can sign up to become a member. You'll get our news and action e-alerts to keep up to date on all sorts of breast cancer issues. You can join us on Facebook and Twitter and connect with others and help change the conversation about the breast cancer epidemic. You can also help others get involved. You can tell your friends, your coworkers, and family about this webinar and also other ways that they can get involved that you can find on our website. And last, you can donate to support our education and advocacy work. So I want to give a really big thank you to Gary and Mandy for their presentation, and I'd like to now open it up to any questions you may have on this topic. And people have been typing in questions as we've been going through the webinar, and I want to let everyone know that you can continue to type in questions and we will get to as many as we can. So there was a question, Gary, about Health News Review and which media sources you review, and also if those are U.S.-based or if there are any international media sources.
Yeah, you can see who they are. If you go to the top of the website, there's a horizontal navigational menu, and in the About pull down, you'll find how we review and whom we review. And they are all U.S.-based. You know, we have more news organizations than any country on the face of the earth, so we have our hands full just with scratching the surface, frankly, of U.S. news coverage. We never, ever, on any day, get to everything that falls into our net. I should say that there have been, depending on whom you count, about 6 parallel efforts around the globe, almost identical to what we do. The pioneering effort was in Australia, then a Canadian effort launched about the same time as ours, and then there were other efforts in Hong Kong, Japan, and Germany. Unfortunately, many of them are going out of business, and our own project loses its funding July 1, and I don't have any replacement funding in place right now, so maybe I should put out the donate call as well. But it just seems to me there's really a role for foundations to support efforts like this. I don't want to take industry money either, and haven't. I think that there could be an expanded role for expanded support from foundations, both in this country and internationally, to support efforts like this, because now Australia has closed down, Canada has closed down, we're on the ropes. Japan and Hong Kong really never became very active, to the best of my knowledge. Germany seems to be flourishing. I helped launch the German site. Maybe I should move there.
Thank you, Gary. There's a couple of people who are asking if you have any advice for a consumer who is interested in giving some feedback or sort of getting involved maybe more with a local newspaper or magazine in their city?
Well, I'll take this first and then throw it to Mandy.
Sure.
You know, use Health News Review and our 10 criteria as a shield, as a tool, as a foot in the door, that if you see things in your local media that you don't think are quite right and don't live up to our criteria, you can always say, you know, these guys have been around the block for a while and have quite a track record and quite a reputation. Why don't you pay a little attention to what they're doing and see if it can improve your efforts? Andy, what do you think?
Also contact, you know, if you know some of the local reporters, or even if you don't know them, contact them directly and sort of introduce yourself and tell you, you know, most reporters will ask for quotes from patients or from people who've had diseases or current or survivors of it, and just kind of introduce yourself to the reporters that you see or that you read about, and build a connection or a relationship with local media. And I think that's sort of a way to get your voice out there. You know, and Gary had also said letting them know about healthnewsreview.org, but doesn't hurt just to call a reporter up and say, you know what, I didn't agree with that story, and here's why. And you know, if you have any future ones, you want to get a quote from someone, I'm willing and able to talk to you.
Great, thank you. There's another question wondering if you see any examples of media sources that are doing it right, or maybe hitting more of those criteria.
Well, let me say that even though we've done 1,900 stories, nothing to sneeze at, it's still a quite limited sample with any one news organization. Nonetheless, from our limited experience, the data would show that we're pretty lucky in that two major wire services in this country, the Associated Press and Reuters Health, probably grade as well or better than anybody else in our experience. So that's good, because many people subscribe to those services and their tentacles reach out into many corners of journalism. We just gave a 5-star review today to a melanoma cancer story to Ms. Sabo at USA Today, who I know works really hard on these issues. Wall Street Journal has always shown its commitment to healthcare news. And on any given day, the New York Times and LA Times have shown their commitment on these issues as well. But let me just wrap up by saying every dog has his or her day and has his or her day off. So we see wide variability. The New York Times can be really hot or really cold. And it just shows, I think, the importance and the difference that an individual can make in any setting.
Great. So we're getting to the end of our time. I want to wrap up with this one last question, and then we'll wrap. Someone asked, so have you seen change or progress in the media and the media's coverage of healthcare after 7+ years of Health News Review?
I'm going to talk squarely out of both sides of my mouth. I think that we are seeing, at one and the same time, some of the best healthcare journalism and some of the worst. I view it as, picture a mountain range, and you have two peaks, one on your right and one on your left, and a wide valley in between. We have these peaks of excellence with special report investigative projects that are wonderful. But the valley of the daily drumbeat of dreck, as I call it, between these peaks of excellence is becoming wider and deeper. And I fear that that valley of dreck overwhelms the occasional peaks of excellence. But there isn't any question in my mind. In fact, there was a paper just presented to a journalism conference or just accepted for a presentation in Washington this summer, where a University of Florida team looked at healthnewsreview.org data, and they're going to report on the fact that there was small but apparently significant increases in, I think, 8 of our 10 criteria, the performance on 8 of 10 criteria over the course of our 8-year existence. So there's reason for hope.
Great. Well, thank you again, Mandy and Gary, and thank you, everyone, for all your thoughtful questions and comments. And there were a number of questions that we weren't able to get to today. If you would like to follow up with us, you can do that at info@bcaction.org. Again, thank you all for attending, and you will be getting an email with a short survey where you can provide feedback about this webinar. So thank you again, and good afternoon.